Hello everyone, this is Dr. Ghazali, teaching assistant at the Department of Anatomy, Faculty of Medicine, University of Khartoum. Welcome to our third practical in the upper limb module. In this practical, we will see the axilla and its contents. In the first station, we will discuss the boundaries of the axilla. In the second station, we will see the axillary artery and veins and their branches in the axilla. In the third and the fourth stations, we will see the brachial plexus. It is roots, trunks, divisions and cords and all their branches in the axilla. Now let's go to station 1. The axilla is the space between the upper arm and the side wall of the thorax. It is bounded in front and behind in real life by the axillary folds, and the axilla communicate superiorly with the root of the neck in the posterior triangle. The axilla is very important space because it carries the neurovascular structures for the upper limb and the lymph node of the upper limb and the side wall of the thorax. Now let's talk about the boundaries of the axilla. The anterior boundary of the axilla is composed of this muscle, pectoralis major, and behind it, this muscle is pectoralis minor, and a fascia called the clavipectoral fascia. So the anterior boundary is the pectoralis major, pectoralis minor, and the clavipectoral fascia. The posterior boundary of the axilla is also 3 muscles. The first one, as you can see here, this muscle and continues upward here, this is the subscapularis muscle. Immediately beneath it, this muscle is called teres major. So this is teres major, and inferior to it, the tendon of latissimus dorsi. So the 3 muscles are the subscapularis, teres major muscle, and the tendon of latissimus dorsi. Okay, the medial border of the axilla is formed by this muscle called serratus anterior. The axilla continues from upward up to the fourth rib. So the lower border of the medial wall is the fourth rib. Okay, the apex of the axilla composed of the clavicle and the outer border of the first rib and the upper border of the scapula. As we said, this apex is the connection between the axilla and the posterior triangle of the neck through which structure pass. Okay, the floor of the axilla is formed by 2 fascia called the axillary fascia and the suspensory ligament. Now let's go for the contents of the axilla in the second station. In this station, we will talk about the contents of the axilla. We will start by the axillary artery, the axillary vein, and then see the brachial plexus in the next station. First, let's have some orientation. This is the neck of the cadaver. This is the anterior thoracic wall. This is the medial thoracic wall, and this is our upper limb. This is the shoulder. Okay. Again, let's reflect the anterior border, which is the pectoralis major, and pectoralis minor. As you can see here, there are two vessels. This one is the axillary artery, and this one is the axillary vein. Okay, the axillary artery is the main blood supply to the upper limb. It commences at the outer border of the ferrous strip. If this is the ferrous strip, if this is the ferrous strip in its outer border, here in the mid-clavicular point commences the axillary artery. The axillary artery is the continuation of the subclavian artery. So, this is our axillary artery. The axillary artery, for descriptive purposes, is divided into three parts by the pectoralis minor muscle. So, this is the pectoralis minor in the anatomical position. Above the pectoralis minor is the ferrous part of the axillary vein. Behind the pectoralis minor is the second part, and below the pectoralis minor is the third part. The axillary artery ends at the lower border of teres major muscle, from which it becomes the brachial artery. Okay, so the axillary artery is a continuation of the subclavian at the outer border of the ferrous strip, and continues until the lower border of teres major to become the brachial artery. Let's talk about the ferrous part. The ferrous part, as we said, is the part above the pectoralis minor. It has got only one branch called the superior thoracic artery. The superior thoracic artery gives blood supply to pectoralis muscles. Okay, it lies above. This one lies above the pectoralis minor muscle. The second part, which lies behind the pectoralis minor, has got two branches. The first one lies in the upper surface of the pectoralis minor, is called the thoracoacromial trunk. As you can see, it is one trunk that immediately bifurcates into four branches. For example, this is one branch, this is another branch, and this is a third branch. The branches of the thoracoacromial give blood supply to the pectoralis muscles and the deltoid muscle, and it gives blood supply to the clavicle and to the acromion. So, two bones, the clavicle and the acromion, and two muscles, the pectoralis and the deltoid. So, this is our first branch in the second part, which is called the thoracoacromial. The second branch, which is found in the lower boundary of the pectoralis minor muscle, which is this one. This is the lateral thoracic artery. Okay, the lateral thoracic artery supplies the serratus anterior pectoralis muscle, and in the female it supply the breast. Okay, so this is the lateral thoracic. For the third part of the axillary, we will shift to the next cadaver because it is more clear there. Regarding the branches of the third part of the axillary artery, to expose the artery, this is the anterior wall, pectoralis major and pectoralis minor. The part of the artery below the pectoralis minor is the third part of the axillary. As you can see here, the axillary artery has got a relation with the axillary vein and the branches of the brachial plexus. To see the branches of the third part, this is our third part, and this is the first branch, this one. It is called the subscapular artery. The subscapular artery, after a short while, it gives this branch, which is the circumflex scapular, and it then continues downward. So the subscapular artery gives the circumflex scapular and then changes its name into thoracodorsal artery, which supply the latissimus dorsi muscle. So this is our first branch, which is the subscapular, the subscapular artery. The second two branches are the anterior and posterior circumflex humeral arteries. The anterior circumflex humeral passes behind this muscle, which is coracobrachialis, and the long head of the biceps to supply the shoulder. The posterior circumflex humeral passes into this space, which is called the quadrangular space. The quadrangular space lies between teres major muscle and teres minor muscle superiorly. The lateral head of the triceps medially and the humerus medially. So this is the quadrangular space in which passes the posterior circumflex humeral artery with accompanying the axillary nerve. The posterior circumflex humeral give blood supply to the teres major, the deltoid, and the long and lateral head of the triceps. Now let's move to the axillary vein. As we said, it has got an anteromedial relation to the artery. The axillary vein commences at the lower border of teres major as a continuation of this vein, which is the basilic vein. So the basilic vein in the lower arm at the lower border of the teres major becomes the axillary vein. The axillary vein immediately receive the venae committents of the brachial artery, and at the outer border of the first strip it receives the cephalic vein. Also it has got tributaries resembling the branches of the axillary artery draining into the axillary vein. The axillary vein enters the root of the neck anterior to a muscle called scalenus anterior. That's all for the axillary artery and the axillary vein. Regarding relations of the axillary artery, in the first part, the chords of the brachial plexus is as follows. The lateral chord and the posterior chord are superolateral, while the medial chord is immediately posterior. Okay, this is in the first part. In the second part, the relation as the name of the chord indicates. So the lateral chord is lateral, the medial chord is medial, and the posterior chord is posteriorly. And the axillary vein is always anteromedial to the artery. In the third station of our practical, we will discuss the brachial plexus. For more orientation, this is the neck of the patient, anterior thoracic wall, and the upper limb. Okay, when exposing the anterior, this is pectoralis major and this is pectoralis minor, and all these are the content of the axilla. The brachial plexus is formed by 5 roots of the anterior rami. Okay, this is C5, C6, C7, C8 and T1. Okay, the roots emerge between two muscles, scalenus anterior and scalenus medius. So between the scalene muscle we find the roots, 5 roots. Okay. In the posterior neck triangle, the roots form the trunks. So the C5 and the C6 unite together to form the upper trunk. The C7 continue to form the middle trunk. C8 and T1 unite to form the lower trunk. So in the posterior neck triangle, we find the three trunks: upper, middle, and lower trunks. Behind the clavicle, the trunks divides into anterior division and posterior division. Each trunk divides into anterior and a posterior division. The anterior divisions of the trunk collectively innervate the flexors compartments, while the posterior divisions unite to supply the extensors compartment. Now, the anterior division of the upper trunk and the middle trunk unite to form the lateral cord in the axilla. So the anterior division of the upper trunk and the middle trunk unite to form the lateral cord, while the anterior division of the lower trunk form the medial cord. So this is the medial cord, this is the lateral cord, while the three posterior divisions unite to form the posterior trunk. As we said, the cords have got relation with the axillary artery, specifically the second part. The lateral cord is lateral to the artery. The medial cord is medial to the artery, while the posterior cord is posterior to the artery. Okay. All right. Now let's recap. The brachial plexus is composed of 5 roots between the scalenus muscle and 3 trunks in the posterior neck triangle. The divisions is found behind the clavicle, and the cords and their branches is found in the axilla. Now we have got 3 branches that arises from the roots. Okay, these are the roots. We have got 3 branches arising from them. Okay, the first one, as you can see, this one pierces this scalenus medius and passes backward. It is called the dorsal scapular nerve. The dorsal scapular nerve is from C5, and it is the nerve to the rhomboids. It supplies the rhomboid major, rhomboid minor, and levator scapulae. So it heads posteriorly with the dorsal scapular artery. The second branch, which is not visible here, is the nerves to subclavius, that from C5 and C6 heads into the subclavius muscle, but it is cut. The third branches of the root is called the long thoracic nerve. The long thoracic nerve supplies the serratus anterior muscle. This is the long thoracic nerve. If I stretch it, you will see that it comes from the roots. It arises from C5, C6, and C7, and as we said, it runs in serratus anterior and supplied segmentally. So the 3 nerves of the root are the dorsal scapular, the nerve to subclavius, and the long thoracics. Okay, we have got 1 branch that arises from the trunks. This branch arises from the upper trunk. It is called the suprascapular nerve. The suprascapular nerve arises from the upper trunk, as we said. It supplies supraspinatus and infraspinatus nerve. It crosses the posterior triangle of the neck to pass in the suprascapular foramen. Okay, this is the suprascapular nerve. Okay, now we will talk about branches of the lateral cord. We said that we have got lateral cord, this one. We have got lateral cord, we have got posterior cord, and we have got a medial cord. So each one of these cords have got branches. We will go through them together. This one is the lateral cord. As we said, it is the continuation of the anterior division of the upper and middle trunks. Upper and middle trunks anterior division form the lateral cord. The lateral cord has got 3 branches. Okay. The first one is this one, arises high up from the lateral cord to supply the pectoralis major. It is called the lateral pectoral nerve. This is the lateral pectoral nerve. The second one is this one that pierces the coracobrachialis muscle. It is called the musculocutaneous muscle, musculocutaneous nerve. The musculocutaneous nerve supplies the coracobrachialis, the biceps, and the brachialis muscle, and continues downward to form a lateral cutaneous nerve of the forearm. Okay. So we have got 3 branches of the lateral cord. This one is the lateral pectoral. This one is the musculocutaneous. The third one is called the lateral root of the median nerve. The median nerve, this one is formed by 2 roots, lateral root and a median root. So the lateral root of the median nerve is a branch from the lateral cord. So the 3 branches are the lateral pectoral, the musculocutaneous, and the lateral root of the median nerve. All right. In the next station, we will see branches of the medial cord and branches of the posterior cord. In the fourth station in our practical, we will discuss branches of the medial cord and branches of the posterior cord. Let's identify our cord. So this is the second part of the axillary artery, and the medial cord lies medial to it. So this is our medial cord. Our first branch is this one. This is called the medial root of the median nerve. So this is the median nerve, and this is the medial root, is a branch from the medial cord. Next to it, this nerve that lies in the medial aspect of the arm is called the ulnar nerve. This is the ulnar nerve. The ulnar nerve and the medial root of the median nerve complete the M shape, as you can see here. Okay. Posterior to it, to them, and medially, there is this branch. It is called the medial cutaneous nerve of the forearm. This nerve supplies the skin of the forearm. There is another branch. It's smaller and it is cut in this cadaver. It's called the medial nerve of the arm. It will be the most medial structure and supply the skin of the arm. There is another and last branch of the medial nerve that supply pectoralis minor is called medial pectoral nerve. So the branches of the median root, the medial cord, branches of the medial cord are medial root of the median nerve, the medial cutaneous nerve of the forearm, and the ulnar nerve, medial pectoral nerve, and medial cutaneous nerve of the arm. Now let's see branches of the posterior cord. When we talk about the posterior cord, we have to retract all the structure and see our cord. So this is the posterior cord. So it is found posterior. It's found posterior to the second part of the axillary artery. Okay, it again has got 5 branches. Okay, this one type. This branch that supply the dorsalis, the latissimus dorsi, is called the thoracodorsal nerve. If we follow it, we will see that it originates from the posterior cord. Immediately above the thoracodorsal, we find the upper subscapular, and immediately below it, we find the lower subscapular. This one is the lower subscapular, and it gives innervation for the subscapularis muscle and teres major muscle. So now we have seen the thoracodorsal and the lower subscapular. Okay. To see the other 2 branches, this branch that goes into the quadrangular space is called the axillary nerve. The axillary nerve is composed of C5 to C7, and it goes into the quadrangular space with the posterior circumflex humeral artery. The last branch and the biggest, which is the continuation of the posterior cord, is the radial nerve. The radial nerve carries nerve roots from all the brachial plexus and goes into the triangular space with the profunda brachii vessel. So this is the radial nerve. Okay. In order to put all the brachial plexus branches in a complete picture, let's see the branches and where we can find them and what structure that can be found passing with them. To understand me, this muscle is latissimus dorsi. The nerve that runs over the this muscle is serratus anterior. The nerve that passes over the serratus anterior is the long thoracic nerve. This is the long thoracic nerve, and the artery accompanying it is the lateral thoracic artery. Okay, this muscle is latissimus dorsi. The nerve of the latissimus dorsi is the thoracodorsal nerve, and the artery is the thoracodorsal artery. Okay, the nerve that pierces the coracobrachialis is musculocutaneous. The musculocutaneous, the median nerve and the ulnar nerve form the M shape. So the ulnar nerve is a branch from the medial cord. The median nerve composed of a median root and a lateral root and a musculocutaneous. Okay. Posterior to the artery, we have got 2 main branches. This one is the axillary going to the quadrangular space, and the continuation is the radial nerve. Other branches, this one that goes medially, it is the medial cutaneous nerve of the forearm. Now let's see again the axilla from another specimen to see the branches further. Again, let's identify contents of this specimen. So this is the pectoralis major and this is the pectoralis minor. The nerve that pierces the pectoralis minor and supply pectoralis major is the medial pectoral nerve. So the medial pectoral nerve pierces pectoralis minor and supply pectoralis major. So this is the medial pectoral nerve. Okay, let's identify our M shape. This is the median nerve and this is the ulnar nerve. So the most medial is the ulnar nerve. This is the ulnar nerve. This is the medial root of the median nerve, and this is the lateral root of the median nerve. Okay, this is musculocutaneous. The musculocutaneous pierces this muscle, which is coracobrachialis. Okay, the nerve that runs in the serratus anterior is the long thoracic nerve, and the nerve that runs and supply the latissimus dorsi is the thoracodorsal nerve. Okay. Now, if we follow the branches of the posterior cord, we will see here, this is the thoracodorsal, and this is the lower subscapular, and superiorly this is the upper subscapular. The other two branches here, the one that goes into the quadrangular space is the axillary, and the one that runs in the triangular space, and it is the continuation of the posterior cord, is the radial nerve. Okay. Regarding the root values, the branches of the lateral cord are composed of C5 to C7s. The branches of the medial cord are from C8 to T1, with the exception of the ulnar nerve, which carries C7 fibers. The posterior cord carries branches from all the roots. Specifically, the radial nerve is from C5 to T1. The axillary is from C5 to C7, and the thoracodorsal is from C6 to C8. This is regarding the branches of the brachial plexus. Now, let's say the artery. The artery that goes into the quadrangular space is the posterior circumflex humeral, and the artery that supply the latissimus dorsi is the subscapular artery, giving the circumflex scapular, then change its name into thoracodorsal artery. Okay. That's all for the axilla. When we come to the hands-on sessions, you will have the chance to identify these structures individually. Thank you.